Hey everyone! Today we're diving into a topic that could literally be a lifesaver. 6 common medications that might be quietly increasing your risk of a heart attack. I know, it's a heavy topic, but stick with me. This is crucial stuff. Imagine this. You're popping a pill you've taken for years, thinking it's helping you, but behind the scenes, it could be putting your heart at risk. That's exactly what happened to my friend Sarah. She was taking a medication for a completely unrelated issue, and one day, out of nowhere, she felt this tightness in her chest. Thankfully, she's okay now, but it got me thinking, how many of us are unaware of the hidden dangers in the meds we take every day? In this video, I'm going to walk you through 6 medications that could be silently jeopardizing your heart health. These are drugs you might be taking right now, maybe even ones you grabbed off the pharmacy shelf without a second thought. By the end of this, you'll know what to watch out for, how to talk to your doctor, and how to protect your heart. Let's get started. 1. Hormonal contraceptives. Let's kick things off with hormonal contraceptives. These have been a game changer for millions of women, giving them control over family planning and reproductive health. But here's the thing. Some of these medications, especially the ones combining estrogen and progestin, can come with a hidden cardiovascular cost. Picture this. My cousin Emma, who's in her late 20s, started taking birth control pills a few years ago. She's super active, eats healthy, and never thought twice about her heart. But one day, she read about a study that freaked her out. It showed that combined hormonal contraceptives, like the pill she was on, could double her risk of a heart attack or stroke. That's when she started asking questions. Here's the deal. Combined hormonal contraceptives, like pills, patches, or rings, contain estrogen and progestin, which work together to prevent pregnancy. But estrogen can mess with your body's clotting system, making your blood more likely to form clots. These clots can lead to serious issues like a heart attack or stroke. A massive study of over 1.5 million women in Sweden found that those using combined pills had about a 1.7 times higher risk of heart attack compared to non-users. That's roughly 1 extra heart attack for every 12,000 women each year. Non-oral options, like patches, can be even riskier. Some studies suggest they increase heart attack risk by up to 3 times. Now, progestin-only options, like the mini pill, implants, or certain IUDs, are generally safer for your heart. The same Swedish study found that progestin-only IUDs showed no increased risk of heart attack or stroke, making them a solid choice for women worried about cardiovascular issues. But if you're on a combined contraceptive and you smoke, have high blood pressure, or have a family history of heart disease, your risk is even higher. Emma, for example, decided to switch to a progestin-only IUD after talking to her doctor just to be safe. So, what's the takeaway? If you're using hormonal contraceptives, don't panic, but do have a conversation with your healthcare provider. Ask about your personal risk factors and whether a progestin-only option might be better for you. Your heart will thank you. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Next up, let's talk about non-steroidal anti-inflammatory drugs, or NSAIDs. These are the go-to meds for pain relief. Think ibuprofen, aspirin, or diclofenac. They're in every medicine cabinet, and most of us don't think twice about taking them for a headache or a sore back. But here's a story that might make you pause. My neighbor, Mike, is a marathon runner. He's in great shape, but after a tough race, he was popping ibuprofen like candy to manage knee pain. One day, he noticed his heart was racing, and he felt dizzy. A trip to the doctor revealed his blood pressure had spiked, and his doc warned him that NSAIDs could be stressing his heart. NSAIDs work by blocking enzymes called COX-1 and COX-2, which help produce prostaglandins, chemicals that control inflammation, but also keep your blood vessels relaxed and your platelets from clumping too much. When you mess with that balance, you can end up with higher blood pressure, narrower blood vessels, and a greater chance of blood clots. A major review in the Journal of the American College of Cardiology found that NSAIDs like diclofenac could increase the risk of heart attack by up to 50% in some users, especially with long-term use or high doses. Even over-the-counter ibuprofen isn't risk-free. It can raise your heart attack risk within just a few weeks of regular use. Not all NSAIDs are created equal though. Naproxen, for example, seems to have a slightly better safety profile when it comes to your heart, but for someone like Mike, who is taking high doses of ibuprofen for weeks, the risks were real. The FDA even warns that the longer you use NSAIDs and the higher the dose, the greater the danger. So, what can you do? First, use NSAIDs at the lowest dose and for the shortest time possible if you've got heart disease or risk factors like high cholesterol. Talk to your doctor about alternatives like acetaminophen or physical therapy, and always keep an eye on your blood pressure while using these meds. Mike switched to a topical pain reliever for his knee, and his heart's been happier ever since. 3. Thiazolidinediones, diabetes medications. Now, let's move on to a class of diabetes drugs called thiazolidinediones, or TZDs, like pioglitazone and rosiglitazone. These meds are designed to help people with type 2 diabetes control their blood sugar by making their bodies more sensitive to insulin. But for some, they come with a serious catch. Let me tell you about my Uncle Joe. He's been managing type 2 diabetes for years, and his doctor prescribed rosiglitazone to keep his blood sugar in check. Joe thought he was doing everything right, eating better, exercising, taking his meds, but then he started feeling short of breath and noticed his ankles swelling. His doctor told him it was heart failure and the culprit, possibly the rosiglitazone. Here's why. TZDs, like rosiglitazone, activate something called PPAR gamma receptors, which help with blood sugar, but can also cause your body to retain fluid and mess with your cholesterol levels. A landmark study in The Lancet found that rosiglitazone was linked to a 30–40% increased risk of heart failure in some patients. Another analysis showed a 35% higher chance of heart attack in users compared to those on other diabetes meds. Pioglitazone, another TZD, has a slightly better safety profile, but still carries risks, especially for heart failure. The scary part: these risks aren't always obvious until it's too late. Joe's doctor switched him to a different diabetes medication, and his symptoms improved, but it was a wake-up call. If you're on a TZD, especially rosiglitazone, ask your doctor about alternatives like metformin or SGLT2 inhibitors, which may be kinder to your heart. And if you notice swelling, shortness of breath, or sudden weight gain, don't wait. Get to a doctor ASAP. 4. Certain antidepressants. Mental health is just as important as physical health, but some antidepressants can put your heart in the crosshairs. We're talking about two main types: tricyclic antidepressants, TCAs, like imipramine, and selective serotonin reuptake inhibitors, SSRIs, like citalopram. Let's talk about my coworker, Lisa. She's been battling depression for years and was prescribed a TCA called amitriptyline. It helped her mood, but she started feeling dizzy every time she stood up, and her heart would race. Her doctor explained that TCAs can mess with your heart's rhythm and blood pressure. TCAs work by boosting neurotransmitters like serotonin and norepinephrine but they also block certain receptors that control heart function. This can lead to a drop in blood pressure when you stand, a faster heart rate, or even dangerous arrhythmias. Studies in the American Heart Journal show that TCAs can prolong the QT interval on an ECG, increasing the risk of life-threatening heart rhythms, like ventricular tachycardia. For someone with heart disease, this is a big red flag. SSRIs, like fluoxetine or citalopram, are generally safer, but they're not perfect. Citalopram, for instance, can also prolong the QT interval, especially at higher doses. The FDA issued a warning to keep citalopram doses below 40 mg daily to minimize this risk. A study in the British Medical Journal found that high-dose citalopram was linked to a small but real increase in arrhythmia risk. Lisa's doctor switched her to an SSRI with a better heart safety profile, and she's doing much better now. If you're on an antidepressant, especially a TCA, and you have heart issues, talk to your doctor about switching to an SSRI or another option, and keep an eye out for symptoms like dizziness, palpitations, or fainting. They could be your heart sending an SOS. 5. Pseudoephedrine. Next, let's talk about pseudoephedrine, a common ingredient in cold and allergy meds like Sudafed. It's great for clearing a stuffy nose, but it can be tough on your heart. I remember when my buddy Tom caught a bad cold last winter. He was taking pseudoephedrine to get through work, but he started feeling jittery and his blood pressure shot up. At his next checkup, his doctor told him pseudoephedrine was likely to blame. Pseudoephedrine is a stimulant that narrows blood vessels to reduce nasal congestion, but that same narrowing happens all over your body, which can raise your blood pressure and make your heart work harder. A study in the Journal of Clinical Hypertension found that pseudoephedrine can increase systolic blood pressure by 5-10 mmHg in some people, even those with normal blood pressure. For someone with hypertension or heart disease, this can be enough to trigger a heart attack or arrhythmia. There have even been rare cases where pseudoephedrine was linked to acute coronary syndrome, a fancy term for a sudden blockage in the heart's blood supply. If you've got heart issues, or you're taking meds like beta blockers, pseudoephedrine can be especially risky. Tom switched to a saline nasal spray, and his symptoms stayed under control without the heart scare. Lesson: check the label on your cold meds. If you see pseudoephedrine and you've got heart concerns, talk to your doctor about alternatives like antihistamines or nasal sprays, and always monitor your blood pressure when using these drugs. 6. Certain antipsychotics. Finally, let's talk about antipsychotics, which are used to treat conditions like schizophrenia or bipolar disorder. These meds, like risperidone or olanzapine, can be life-saving for mental health, but some come with cardiovascular risks. Take my friend Alex, who was diagnosed with bipolar disorder a few years ago. He was prescribed olanzapine, and it really helped stabilize his mood. But over time, he gained weight and his cholesterol levels spiked. His doctor warned him that these changes could increase his heart attack risk. Antipsychotics, especially second-generation ones like olanzapine, can cause weight gain, high blood sugar, and elevated cholesterol, all major risk factors for heart disease. A study in the Archives of General Psychiatry found that patients on olanzapine had a 2 to 3 times higher risk of developing metabolic syndrome, which can lead to heart attacks. Some antipsychotics, like risperidone, can also prolong the QT interval, raising the risk of arrhythmias. Alex worked with his doctor to switch to a different antipsychotic with a lower risk of metabolic issues, and he started a healthier diet to keep his heart in check. If you're on an antipsychotic, regular checkups are key. Monitor your weight, blood sugar, and cholesterol. Ask your doctor if there's a medication with a better heart safety profile, like aripiprazole. That might work for you. So, there you have it. 6 medications that could be silently putting your heart at risk. Hormonal contraceptives, NSAIDs, thiazolidinediones, certain antidepressants, pseudoephedrine, and antipsychotics. Stories like Sarah's, Mike's, Joe's, Lisa's, Tom's, and Alex's remind us that even common meds can have hidden dangers. The good news: you have the power to protect your heart.